Welcome to today's meeting of the Health Committee. Members of the public may like to follow at London Assembly on Twitter and use the hashtag AssemblyHealth for this meeting. Please may I remind participants to silence your devices. The main item on the agenda today is the impact of the pandemic on early years development and support services. Can I now ask our clerk, Diane Richards, to confirm any apologies for today's meeting?
Thank you, Chair. No apologies have been received for today's meeting.
Thank you. And can we note the list of offices held by Assembly members? And can I also ask members if they have any disclosable pecuniary interests in any specific items listed on today's agenda? Thank you. Can we also note the membership and chairing arrangements as agreed by the London Assembly on the 9th of May 2022? And can we note the committee's terms of reference as agreed by the London Assembly on the 9th of May 2022? Noted. Thank you. Can we note the standing delegations of authority to me as chair of the committee as agreed by the London Assembly on the 9th of May 2022? Can we confirm the minutes of the meeting held on the 2nd of March 2022? And can we note the completed and closed actions arising from the previous meetings of the committee? Thank you. This one's slightly longer. So can we note the actions taken under delegated authority by the former chair in consultation with party group lead members to agree, first of all, the committee's Reducing Drug Deaths in London report, the committee's Trans Health Matters Improving Access to Healthcare for Trans and Gender Diverse Londoners report, and also the committee's letters to the Secretary of State for Health and Social Care and the Mayor of London regarding NHS waiting times and workforce strategy. Thank you. And can we note the response from the Home Office to the committee's report Reducing Drug Deaths in London, and also the response from the Mayor of London to the committee's Trans Health Matters report? Thank you. Thank you, Assembly members. This brings us to the main item for today. I'd like to warmly welcome our first panel of guests joining us to discuss the impact of the pandemic on early years development. It's quite a small committee and a small number of guests, so I'm actually going to ask everyone to just introduce themselves just so they know who they are. So I'll start with myself and then move to my left. I'm Krupesh Rani. I'm the Assembly member for Brenton Harrow and the chair of this committee.
I'm Zoe Watts. I'm staff of the Secretariat.
Tim Gallagher, also staff of the Secretariat.
Emma Best, London-wide Assembly member.
Andrew Boff, London-wide Assembly member.
Joanne McCartney, Assembly member, but here as Deputy Mayor for Children and Families.
Tom Coffey, Health Advisor to the Mayor.
Vicky Hobart, GLA Group Director of Public Health and Deputy Statutory Health Advisor to Professor Fenton, Kevin Fenton.
Hi, Joe Lane. I'm the Head of Policy and Research at Action for Children.
Caroline Russell, London-wide Assembly member.
Onkos Hota, member for Ealing and Hillingdon.
Diane Richards, Committee Services Officer and Clerk for the Health Committee.
Thank you, and we'll jump straight into questions. So the first question is from myself, and it's one for all the guests. So maybe if we can start with Joe and then move from Vicky to Dr. Tim Coffey and then Joanne. So Joe, how important are the first 5 years of a child's life for their development, and what sorts of disparities can be seen between children from disadvantaged backgrounds and their better off peers by the age of 5?
Yeah, thanks very much. I feel like both me and lots of people in this room could speak for a long time about this. And, you know, lots of the stuff is very well known. So just, I guess, by way of quick intro, Action for Children is a national children's charity. We work in sort of all 4 nations across the UK. And that includes providing services to nearly 30,000 under 5s. So that's running children's centres, family hubs and other services. I think from our perspective, you know, we're sort of very passionate in belief and sort of backed up by the research which highlights that the sort of outcomes for a 5-year-old are a very strong predictor of later life outcomes, so whether that is school attainment or in things like health and well-being. I think, you know, one thing we would say is crucial, and this sort of nods to the second session, is it's important not to be sort of reductive in the sort of type of support services that 0 to 5s need. So, you know, as sort of any other age range, you know, 0 to 5s need a broad range of services that includes good childcare, but it, you know, includes sort of family support services, health services, to make sure those children get that broad range of support they need to set them up for a sort of to thrive later in life. And I think in terms of the disparities, again, you know, there's huge amounts of research on this, but I think sort of the crucial things are, you know, when children start school, we know that children from disadvantaged backgrounds are already months. I think, you know, it sort of ranges between 4 and 5 months behind in terms of measures of their good level of development. And I think, you know, there's really strong data in London to say, you know, that is true in every borough in London, and you know, between boroughs there's different levels of disparities that have appeared by age 5. So sort of short version of that is, you know, it couldn't be more important. It's almost impossible to overstress that, and disparities are sort of already deep and, you know, set up children on a very difficult path to sort of close those gaps across a range of outcomes later in life.
Thank you. So building on what Joe's already described, for us in London, a population of about 9 million, we have about 600,000 children under 5, so about 7% of us are under 5. And actually, if you look at those individual year groups, you actually, you know, those numbers in each year born are actually much higher in the under 5s than they are as they go into primary and secondary school. And we know that our working age population is also a lot higher in London, so early years are a real issue for us, given that the size of the working age population as well, and people of childbearing age in London. I couldn't start without referencing the impact of the pandemic. So we don't know the full longer-term impact yet of the pandemic on population health. We did do some work right at the beginning of the pandemic, looking at the 5 aims of the Health and Equality strategy to try and do a bit of kind of forethinking about what some of those elements might look like in terms of recovery of population health as a system. So working with partners, again, the GLA has relatively limited levers in some of these areas. In terms of the life stage, the critical life stages, there's a lot in the early years life stage, so conception and pregnancy and the health of the mother and the family, the birth process itself, breastfeeding and weaning, the perinatal period when we're very concerned around some of the mortality outcomes for children, as well as successful breastfeeding into weaning, immunisation and screening. So it's a short window and there's quite a lot to do and to deliver. And huge potential to intervene to improve outcomes of children and families that span into the whole of the rest of their life course. In some cases, saving hearing, you know, through to interventions that will help them in terms of development of long-term conditions into older age. The key milestones, we've got the Healthy Child programme, and the better able we are to measure delivery of that and outcomes of that, the better. And there are a number of routine checks that there are services set up to do and deliver, and that's quite a multi-agency approach, so we might want to revisit that at some point. And the outcomes are across a spectrum, so the physical development of the child, cognitive development, emotional and social development. A range of agencies important in that, so when we're looking at how you prevent health inequalities and prevent them widening, it's essentially a very multi-agency approach. The primary care team, the social care team, upstream prevention services, through to very specialist care and support that children with disabilities, for example, may require to reach their potential and flourish. The widening of the gap in some areas that COVID's brought about, Public Health England did a report on that about a year ago. I can talk to some of those outcomes, but maybe that will come up in some future questions, so I'll hold that for now. Thanks.
Thank you. Yes, there'll be a section on the pandemic and questions from there later. Dr. Coffey?
Yeah, thank you very much. So undoubtedly, development of the first few years is vital for the child, and as the child becomes an adult. As a GP, we do our first developmental checks at 8 weeks, and there you're looking at very much a number of areas, the social, the physical, and also the parental assessment at the same time. And I think it's very important not to separate the parent and the child, because the key determinants for a child in their development is very much the child's environment, but also the parenting and the parent's kind of position. So it's very much to see that in the round. Regarding outcomes, one very stark figure is deaths in children. The death rate for the poorest children in London is 3.1 per thousand. Sorry, 5.3 per thousand and 3.1 for the richest. So it's 60% difference in death rate for children for different socioeconomic groups, and that is very stark. Secondly, if you look at children at 16, and the poorest children are 18 months behind in the development at 16, and 40% of that gap has already occurred by the age of 5. If a child is behind at 5, they are much more likely to be excluded from school. So children's development is intrinsically linked to their educational achievement, their social development, their psychological development. And when we look at other indicators of inequalities, maybe a child who's got free school meals, again, there's a 12% gap between those children on free school meals and those not, between their social development at the age of 5. So there is lots of evidence there is a gap at age 5, and it often widens as the child gets older, and it has a big impact on their later life.
Thank you. Yes, I'll endorse what's been said already, but just to add that obviously life chances depend on family circumstances. So we do know that low-income children have worse outcomes, both in health and educational attainment. So when children start school, disadvantaged children are about 4 months behind their better off peers. By the time they leave school, as Tom has said, that gap has widened significantly. But the Early Years Foundation stage profile shows that at the age of 5, there is differences between different groups of children. So, for example, percentage of girls with a good level of development at age 12 is 12 points higher than boys. And then with different ethnicities, there's differences as well. So the highest achieving group at age 5 is Chinese, and the lowest achieving is Black British. So you can see that there's quite wide variant between income, between ethnicity, and often, of course, those two crossover as well.
Thank you, Guess. For the next question, I'm going to turn to Joe. So the COVID-19 pandemic led to the introduction of restrictions on young children mixing with other children, family and friends. What has the impact of this been on the development of young children, and how damaging have the most severe cases been, and how common are these most severe cases?
Yeah, thank you. So I think it's such a big question, and I think I think tomorrow we're due to receive the national panel review into the deaths of Arthur and Stahl, certainly this week, and that's a sort of, in both of those we saw in the sort of initial looks at those, we saw evidence of sort of the lack of contact with services potentially played a role, though those full national panel reviews will sort of tell us more about that. I think at a sort of big picture, there was a brilliant piece of research, I think maybe only published last week by the Education Endowment Foundation, which looked at a sample of the Early Years Foundation stage and showed that the proportion of children reaching a good level of development had fallen from normally around 70%, so I think it was 72% in 2019, and had fallen to 59% in their sample. I think there's a challenge because lots of that data wasn't collected as it normally is, and I think sort of that shines a light on a sort of a secondary challenge, I guess, for people like us as sort of policymakers or people thinking about policy, which is the sort of the insight and oversight that we have of the types of services that children before they reach 5 are using and accessing is very poor. If you compare the way we interrogate, the way sort of attendance at school, the types of subjects that children are studying, we have, you know, lots and lots of detailed information about what children are doing after they're 5. We don't know that much about what they're doing before they're 5, despite what we've all said in the previous question about how important that is. So sometimes...
Just to interrupt you there, sorry. And so what about on the mixing of children with other children or family and friends and peers? Do you have much information on the impact that has had on people?
Yeah, so one thing we're seeing now, I think, so we're starting to see this really. So in our children's centres, one thing that we've seen very clearly is that we're seeing a sort of heightened proportion of, in fact, an increased number of referrals and an increased proportion of referrals that are due to developmental delay. So that will be, you know, somebody has come in touch with a professional elsewhere. That might be a GP, it might be another health professional, an educational professional. And those families are referred to a children's centre because those children are perceived as sort of being behind where they would otherwise be. When we speak to parents, so through one of our services, which is called Parent Talk, which is a digital parenting support service, we sort of spikes of concerns from parents around developmental delay in the lockdowns, essentially. So particularly that first lockdown, I think it was around a third of sort of one-to-one chats that parents initiated with our services said, you know, I'm stuck at home with my 1, 2, 3, 4, 5-year-old, and you know, I know, you know, I've been here before. I've got an older child, and I know they're behind where they should be. What can I be doing? And just lastly, so one thing Action for Children does is we run something called an emergency fund, which provides financial support to families that are struggling. Around 15% of that has been geared specifically towards sort of the home learning environment. So that might be devices or you know, toys and things for children to sort of engage in, play in. And you know, we know, as other organisations know, children in disadvantaged homes have a less rich home learning environment typically, and that, you know, we're starting to see the impact of that as that sort of Education Endowment Foundation research has shown, and those impacts, you know, will be felt in the longer run. You know, all public services will have a job to sort of pick up the pieces of those longer term impacts.
Yes, as well as the Education Endowment Fund, Ofsted have also published a recent report in April of this year, and they expressed concern that the wearing of face masks had an impact on children's communication and language skills. They also, that report talked about children having less confidence when they did get into early years settings, and they were more worried about being left there without parental company, and that particularly babies were very anxious about seeing strangers' faces as well. So I think, you know, as Vicky said, we don't know the long-term impacts yet, but also I think some early warning signs are there that some perhaps intensive work around those support services are going to be needed.
Yeah, and also the Sutton Trust did a survey of parents, and they had 570 parents of children between 2 and 4, and asking them, you know, what was the impact on their children. And so 19% definitely physical delays. They were less likely to be crawling or walking over that 2-year period than you would expect, just because of the fact that physical exposure to activity is reduced. 25% decreased in language development, but the biggest impact they felt was on 50% felt there's an increase in emotional development. That lack of that peer-to-peer kind of interaction, be it in the early years environment or in play, and so therefore, yeah, the impact of the restrictions, you know, was very real, reported by those parents to the Sutton Trust.
Yeah, the only thing to add, I guess, is the circumstances in which children in the early years were isolated or their social interactions changed were quite varied. So for children that were deemed to be clinically vulnerable, and our understanding of that moved on quite quickly, would you say, over the pandemic, particularly as vaccination programs came in, potentially had quite a different experience to young people without those clinical or perceived clinical vulnerabilities in the early stages of the pandemic. And then just the reflection on what a child's family or social circumstances and the extent to which that influences the kind of social mixing that they have, whether that's in a formal early years setting or through family or social networks or in their community. So those kind of 3 levels of clinical vulnerability, family, social interaction, and how that impacts on their interactions with wider society, and then the kind of community or wider determinants of that.
Thank you. I'm going to turn to my colleague, Assemblymember Russell, for the next set of questions.
Thank you, Chair. So I just want to pick up a bit more on the impact on children's development of the pandemic. And I think, we've apparently just 7% of children continued to attend early years settings in the first lockdown. And then I think it was found after the first lockdown that with a survey of schools that 76% of them reported that children starting school needed more support than children in previous cohorts. So that kind of suggests a kind of an impact of the lockdown experience for those children. But I wonder if there is, if you're concerned about any long-term impact of the pandemic on sort of later childhood development on that cohort of children that experienced the lockdowns and less social interaction. And I don't know who wants to. Vicky, were you gearing up to say something?
Happy to make a start. So yes, it's a big ecological study, isn't it? Unprecedented, and a lot of people in different services, different parts of the system, have got mechanisms in place to track some of this. At a population level, the Healthy Start programme is really important. Those stages at which there are reviews by multi-agency services are really, really important in understanding that and tracking that. And at the same time, we need to catch up with unidentified needs that children or their families may have, as well as preventative services. So things like gaps in immunisation, for example, or screening programmes. So there's catch up on prevention, and there's also catch up on identifying children and families with existing needs. In terms of development, from birth right through to kind of being ready to learn at 2, being ready to go to school at 5, and all of the physical, social, emotional, cognitive development that needs to happen. There are very stark figures. I can share the report afterwards that Public Health England did around some of those gaps, and they are quite stark. So we went into this with higher levels of child poverty, and what that would suggest also is when we look at some of the pressures around cost of living and poverty going forward, it's not as simple as what was the impact of the pandemic, kind of being projected forward. It's also the reality of the recovery of family finances, etc. There are some very stark impacts. For example, a rise of 20% in babies being killed or harmed during the first lockdown. So the safeguarding consequences, violence against women and girls, violence in the home, the longer term impact of that trauma is there. The flip side is the evidence on risks, protective factors, the difference that good attachment means, a good relationship with a trusted adult means. There are lots of opportunities to recover. So I'm slightly tempted not to read out this list, because the risk is you read out a list of problems, and they are significant problems, and there are widening gaps, and they are building on entrenched inequalities. However, the evidence base is very rich in this area, but does require real multi-agency work, around the child and around the family to make that difference.
Mm-hmm.
Yeah.
Tom, did you want to?
Yeah, so to answer your question, yes. I think as GP, I would be concerned. What we do know already is that if you've got a developmental delay age 5, it's likely to carry on until you're 16. And so we know that between groups before 2019. And now we're doing a study to say whereby whole cohorts of children are probably got some developmental delay, both in speech, motor and social. And because of perhaps the very strict lockdown, as you say, only 7% of settings open and children attending those settings. So therefore, if we know what's happened before is going to be repeated, it's likely that these children will have long-term impacts. And what probably hasn't happened so far is to look very systematically at their later developmental milestones. That was, let's say, March 2020 to June 2020. So now 2 years on, they're just about to go into more developmental checks. And I think it'd be really useful to know is, have those children caught up? Is it something that in this kind of epidemic, we've seen a delay, but we've seen a catch-up in the 2 years following or not? And if that isn't the case, do we need to do, in fact, a bit more intensive work in that cohort of children? Because that cohort of children we now can follow for the next 15 years. And my belief, I suppose, would be that targeted funding to that cohort of children is probably needed to increase the educational input to address those developmental delays. Otherwise, like previously, they'll carry on till they're 16.
Mm-hmm. Yes, and it's and those inequalities will obviously be worse in the cohorts that Vicky mentioned, who are experiencing the pinch of the cost of living crisis the worst. And Joanne, did you want to come in?
Yeah, a couple of things, if I can. One is just particularly around children with special educational needs and disabilities. We do know from the research that has taken place that practitioners are more concerned about them than any other group. And so I think, going back to Joe's point about his, the referrals going up, I think that's perhaps an indication. So what we need to make sure, saying we don't have a statutory responsibility, but actually that the support services are actually there in place, particularly for those children, so they can catch up as best they can. The other thing you talked about, the reduction of children during lockdown going into the early year settings, that's still not back to where it should be. But there are differences across London, so lots of waiting lists in some parts of London and vacancies in others. But we also see a reluctance from some parents to actually return their children to early years settings, partly because of the concern that still around COVID, there is some residual concern around that. But secondly, I think changing work patterns may mean that more people are working from home, therefore they may try to save money by not sending children to childcare settings, particularly if they have to pay for it above the free early years entitlements.
Mm-hmm. I think we're going to be picking up on that a bit more in the second section, so I'm not going to, I've got questions, but I'm not going to pick up on that so much right now. Joe, did you want to add anything on this question about the impact on later childhood development?
I think probably I can save it for the second session as well, yeah.
Perfect. So just thinking, has the pandemic disproportionately affected development in children from some demographics more than others? And we've had mention of Black, Asian, minority ethnic children, and presumably children with young parents, and particularly children growing up in low-income households. And Joanne mentioned children with disabilities as well. I was also wondering about children from communities like the Gypsy Roma traveller community, and whether, so if you could, yes, sort of talk about sort of more on, how are some demographics being affected more than others, and if any of you are able to discuss at all the impact on Gypsy Roma traveller communities, because I think they are very reliant on outreach support programmes, and I just don't know what's happened for them during the pandemic. Tom, you look like you're ready to go.
I might answer in a way which is bringing in a different dimension about how during the pandemic we moved very quickly to kind of telephone and video-based consulting, and therefore for those communities who've got access to good broadband, a large amount of money left on their phones, that worked quite well. But for those groups who perhaps are digitally excluded, and as you say, require that face-to-face outreach, they were kind of harmed much more because the ability to get healthcare was reduced. So in much of London, school nursing, health visiting, all went virtual. And therefore the ability to kind of pick up those little nuances of a child's development was lost, because often you were just seeing a child and a family on a screen. For the Gypsy and Roma community, as you say, if they're a community which relies on that face-to-face interaction, that outreach interaction, that would definitely be adversely impacted. The second issue, this is about GP registration. What we found also was that those areas which weren't registered with GPs found it more difficult to access the vaccination campaign, and get vaccinated and try to get back and engage in society. And a lot of the Gypsy and Roma community, because they do travel quite a lot, tend not to have a permanent GP registration. And therefore that community, like others, maybe it rough sleepers or also newly arrived migrants who aren't registered, did find it harder to access vaccination, but also health visiting. Services like that, which are very much linked to your GP practice, can be lost. So that's where I would be a bit concerned that the COVID pandemic and the move to a digital type interaction might have even exacerbated further previous inequalities.
Thank you. Does anyone else want to come in on that one?
I can, yeah. So I think one of the first comments in the sort of intro was around the role of the parent being probably the most important sort of mediating factor on outcomes for 5-year-olds. So I think there's that sort of like twin disadvantage for 5-year-olds from marginalised backgrounds, which is that their access to services sort of in their own right are likely to be sort of disadvantaged and more difficult, and their parents are more likely to be facing additional stresses, whether that's through work or access to public services. So there's definitely that sort of like, one thing we can do is look at the disadvantage parents from disadvantaged or...
I'm just going to pause you there because the next questioner is going... So I think I should hand back to the chair because I think this question is straying into the next question.
Yeah, thank you. Thank you,
I'll hand it back.
I haven't got the questions either.
That's fine. That was well. It just shows that things are flowing nicely when that happens. So, Assembly Member Dr. Sahota.
You preempted the question. The question was about the parents of young children and how how the demographics affect those parents, right, and the impact on children. So that was the question which you were about to straight into. So please carry on.
Yeah, thank you. So again, and I think one of the reasons I sort of strayed there is Action for Children runs what we think is this quite innovative service, Parent Talk, which is sort of accessible online. So I think it touches on this sort of move to digital services, and through that we see sort of essentially a sort of daily tracker of the stresses and challenges that parents are facing. Alongside that, we've also done research with parents, and one thing we've been looking at is sort of parental burnout. So that's a sort of like a category of challenges that parents face, or sort of symptoms that parents suffer because of the additional stresses they face of being a parent. And we've seen a sort of rising level of parental burnout, and it's been more likely to affect sort of lower. So I can be confident on sort of lower income groups. I don't want to overclaim on other sort of demographics because I might get the stats wrong, but we can definitely share that research following the session. And so all of those stresses and sort of impacts then, follow on to children. I think worth saying on sort of digital support. So one thing at Action for Children, sort of as a charity, we were able to operate sort of slightly independently of whether it was local authority or commissioner decisions. So we were able to maintain contact with 95% of the families we were in contact with before the pandemic. Lots of that was virtual, and we've had a sort of mixed picture, as every other public service would have, of parents who say that was a real challenge for them, and parents and children who say there were big benefits of that. So things like parenting programs, which parents have been more able to sort of conduct in their own time. Lots of people have said that's been beneficial. So I think it's important to sort of remember those benefits. And then I think finally the other thing that comes up from parents all the time is actually those sort of specialist support services. So it might not be things like parenting programs or children's centres or vaccinations, but advice and information for people with no recourse to public funds or immigrant parents, and where those it's less certain where they get that help, and often it's around being at those sort of universal services where they get signposted to the right people. So those things have really sort of been a challenge for parents, and that's I think the sort of theory is the stress that causes the family then impacts the child in a sort of they have that double impact really.
I just want to pick up on the word you just used now, universal. I want to talk about the universal credit that was given an uplift by the government in the pandemic, and then it was taken away. So I want to find out what was the impact of that £20 per week given to families, rather, or universal credit, right? And then what was the impact of that being taken away?
Yeah, I mean, I can give a super quick answer, which is this is one of those strange things where the government doesn't want to claim credit for a very good policy. So poverty and child poverty fell, during the pandemic. So even though lots of families were facing, incredible financial stresses, they might be going through furlough, through labour market disruption, that £20 increase, directly reduced poverty and child poverty. It was obviously taken away in October last year, and what we know as Action for Children, and there'll be other organisations that know more than us, what we know is that 20% of people who access our emergency fund, so that's where they're working with we're already helping them through a service, and through that support a financial pressure emerges, and a family support worker or an early years professional will highlight that they need financial support. 20% of people who need that, the sort of the primary trigger was losing that £20 uplift. So we've seen, both the sort of the national picture, which is, well, we haven't seen the national picture yet. We'd expect to see rising levels of child poverty when we get last year's data, and we've seen it at a service level because we've seen the impact of that on families accessing our services.
In July 21, the former Children's Commissioner, Anne Longfield, gave her departing speech when she said the government is treating children like data points. Do you think this is still the case, or have things changed since then?
If you could just clarify who that's addressed to.
Well, I'll address it to you.
Yeah, I mean, I can go. I feel like I've been speaking for a long time. I've got lots of respect for Anne Longfield. She did lots of great work in the Children's Commissioner's office. I think one thing that we definitely sort of repeatedly say as Action for Children is what we don't have from government at the moment is a sort of children's or even a family strategy. So we don't have a child poverty strategy. We don't sort of have a child poverty reduction target anymore, statutory child poverty reduction target. I actually think the Department for Education at the moment is making quite significant progress in areas that have been overlooked for a long time. So things like the SEND Green Paper, which looks at reforming and investing in alternative provision and reforming education, care and health plans. The Independent Review of Children's Social Care, which was published, I think, on Monday. So they are starting to sort of piece together those bits of that sort of broad range of services that children need. And definitely, our message to central government from Action for Children is, absolutely they need a sort of children's strategy, and that, included in that needs to be a massive focus on 0 to 5s.
Thank you. Was there any other member of the panel who wanted to come in? Tom?
It was more answering your first question about parenting, the impact of COVID on on parenting and parents. So 20,000 Londoners have died of COVID. Many of those are parents and grandparents who bring up children. And I think the devastation on a family when a family member dies of COVID is enormous, from the child right up to the adult. So I think that pure impact is enough to have a significant effect for many, many years to come. Secondly, for those families who lived in fear of COVID, and that increase of anxiety and mental health crisis, which we saw during the pandemic, and that is carrying on now, is having a massive ability in one's skills to parent one's child. And so I, as a GP, I'm sure you as well, are seeing that increase in level of parents presenting with high levels of anxiety, working in A&E departments, seeing patients presenting in mental health crisis. Many of these are parents who are suffering as a result of the pandemic, and that in itself has an impact on your ability to bring up your child. Because as Joe was saying, it's not just what happens to the child that matters, it's as important what happens to the parent and their ability to look after that child. And COVID had a massive impact in that way on parents.
Thank you. Certainly. Vicky?
Just building on Tom's point, I suppose going into the pandemic, the evidence base about what the risk factors were in a kind of family setting and what the protective factors were relatively clear around domestic violence, substance misuse, mental illness, poverty, housing conditions, and having a parent incarcerated and what that meant for children's development and well-being. And the protective factors, again, fairly clear around parenting, the role of grandparents, stable home environment, but also the secure attachment of having an adult outside the home, even in the kind of early years. So the extent to which that's been disrupted and the interplay with those factors and painting that picture and being clear where the intervention point seems to be, an absolute key priority going forward.
Great. Thank you. Thank you, Chair.
Thank you. Going to turn to Assembly Member Best.
Thank you. Just quickly for my questions, I wanted to come back because we talked heavily there about groups disproportionately impacted and their parents. I wanted to quickly ask the panel what the impact on looked after children is and the support for carers.
Yeah, just clarify who you want to go first. So,
whoever would like to comment on that. Thanks.
I think from an Action for Children perspective, I think so. Action for Children works with both looked after children from sort of in support services and in providing residential care. We work with at least a few hundred children in London through our independent visitors services. I think, to be honest, bearing that in mind, I probably don't have as good an answer as I should do in terms of the impact on those children through the pandemic. So that might be something I can take a look at and come back with, because I think we should be able to give a better answer than I'm able to right now. So I thought I'd just say that I can offer better evidence than I'm able to give in front of you.
Thanks. And just from a GLA perspective as well, so any...
I was just trying to give from a health angle as well. So when a child goes into care, they have an initial health assessment, and that's going to be done within 28 days of being placed into care. And then every 6 months for a child under the age of 2, and every year thereafter, a review health assessment. Those assessments used to be done face-to-face. During the pandemic, they were all done very virtually. And therefore, their ability to make that assessment was by far reduced. Secondly, usually when you have a looked after child health service, the key element of it is child and adolescent mental health services, CAM services. And again, so the CAM services was not only depleted, but again virtual. So that health assessment and wraparound care that happened thereafter was undoubtedly adversely affected by the pandemic. We're now returning to those face-to-face approaches, and I imagine there's quite a large backlog of trying to do those IHAs and RHAs, which are the responsibility of the health system to do for those children. I'm not aware of the numbers, have numbers increased or reduced of looked after children, but I know that those who are in care, their ability to do those assessments have been impacted.
Can I say, although I don't have figures for children that actually entered care, I do have some information about children in need who are often the first stage before, and if that need goes on, then they may be taken into a care. And again, as Tom said, the number of assessments seems to have dropped quite sharply during the pandemic, so that there will be a backlog. And I think Joe talked earlier about an increase in referrals, and I think we're going to be seeing that. But I can send you the information I do have after the meeting.
I was just going to reflect in the earlier stages of the pandemic, where children were being assessed and were going, going into situations of being looked after, it was an incredibly challenging time in terms of those face-to-face assessments, as well as finding the right placements where there was concern about the virus. So there will be a very small cohort within that where their care journey was particularly disrupted at the earliest stages, particularly where there was kind of examples of family breakdown or exacerbations, etc.
Thanks. And I also asked for carers themselves, the support services. I'm really interested in what's happened either to prevent these situations and the backlog during the pandemic, and the support as well for carers. Obviously, I know the information, to be honest with you, Joe. But I'm more concerned about what we're doing from the GLA, and what is this? What can we do to prevent this and work to address that massive backlog now, and also to support carers.
I'll just make the point that it's obviously the statutory responsibility lies with local authorities, and we will obviously do all we can to support them. We do have we convene a London Care Leavers network, so there will be another meeting coming up shortly, and if they haven't already, I will make sure that they will put that on the agenda so they can talk. And what that network does is actually tries to share best practice and try to improve the quality of what's happening. But I can get you some information on that and what they have done and what they might plan to do.
Just looking towards Vicky and Tom here, how will the commitment set out in the Health Inequality Strategy Implementation Plan help to address the effects of the pandemic on early years development and services, particularly for disadvantaged groups? And what impact will the implementation plan and the Health Inequality Strategy have in this area? And how will you measure success?
Yeah, sure. I'll try and start, and almost kind of my initial comment would be that, and I think a point that Joe said as well, that when we're talking about healthy early years and healthy children, it's about healthy families and healthy parents. So the work of the Health Inequality Strategy is very much based around kind of 5 key themes. What we have done already is do a Healthy Early Years programme, where we had an ambition of 1,300 settings. Now we're at 2,100 settings of our early years places, having that Healthy Early Years programme with a 12 kind of area of its curriculum. So the continuation of that, I feel, will have a massive benefit. Some of the new commitments we've done is, and one I would pick out, I suppose, is one on the London living wage. So what we know is that poverty, in-work poverty, has an adverse effect on parents and their ability to look after their children. And that London living wage commitment of trying to raise 48,000 Londoners out of into the London living wage system, I believe will have a big impact improving the wealth and well-being of those parents. Thirdly, we have done a lot of work on mental health first aid, and we've in fact trained 4,000 people in the educational setting to try to make sure that those settings have got people and staff to kind of support those families, those children in those educational settings to improve their mental well-being. We have got a health inequality strategy implementation plan, and we're trying to assess, I've given you some quantum figures already, so can we hit that £48,000 target with our partners? Also with school super zones, and school super zones are very much based in the whole school setting. Obviously some of those schools will have early year settings as well. That, we believe, will improve the well-being of those children. And the final one, I suppose, is a 250,000 wellbeing champions, which we're mental health and wellbeing champions of for London. And these are people who often might have done a suicide prevention course, a mental health first aid course, and done some work which enables them to increase and improve the mental well-being of their community. Their community are parents and grandparents, and it is vital that their well-being is improved to make them good and healthy parents. So therefore, I would say that our programme is quite a holistic programme, working with families, and it's not just purely working with early years providers, it's trying to provide the environment which children thrive in, and that's what we're trying to do. Vicky.
Thank you, Tom. So in terms of how, I guess, we, in the GLA and the levers that the GLA brings around public health outcomes, working closely with the borough public health teams in particular. In terms of child development, the levers are relatively limited directly within the GLA. Boroughs had done a sector-led improvement programme quite in the lead up to COVID, which was looking at the responsibilities that they have in local government around health visiting, school nursing and the family nurse partnership programme. So I guess in terms of partnership working with our borough colleagues and where those interfaces fall, we're interested in support for individuals, families, but also communities. So how can we bring together their interest in things like super zones around schools, healthy places at a very local kind of place level with the evidence base and the priorities that they're setting out for their local children and families. So we work collaboratively in that sense with them. In terms of the impacts that we're hoping to see, as we say, the prioritisation of longer term impacts of COVID and widening inequalities, and the prioritisation of that will be really important. And again, we'll need to work with the NHS and local government colleagues to understand that. And in terms of success measures, some of those are already coming through around outcomes for children. So healthy weight, concerns about low birth weight, where there's been an increase in the last couple of years. And some of those outcomes are relatively soon and we can track. Some of the developmental delay issues, the systems are not necessarily at a population level and aren't necessarily kind of feeding through that data in a way that we can easily kind of access it and understand what's going on. So I'd say we have good engagement at the moment. There's a health equity infrastructure in London with good engagement from the NHS, from local government, etc., to look at this. And prioritisation of having a shared picture of the situation. And you need to build that up from neighbourhood and place and borough level, but to also then understand at the London level what are the priorities and you know, who is best placed to kind of intervene.
Thanks. No, I mean, just only because we're wrapping up, and if I hear more about school citizens and their equality, I might explode. Sorry, because I just think the issue at hand is so different for that. For me, sorry, Tom, we probably disagree. I wanted to ask quickly how, with the mental health budget being reduced this year, how that's going to be helpful in helping parents and carers with their mental health.
So I can talk about the kind of the budgets that we're putting, you know, into some of the projects that we've described. So overall, specifically,
sorry, Tom, just the question around the fact that the mental health budget's being reduced, so and the impact of that, though.
Okay, so do you want to? So which of the mental health budgets?
The mental health and wellbeing missions budget, it was originally £1.5 million and it's being reduced to £0.7 million.
Right. So, so therefore, so the figures I've got, so the overall budget is 2.71 million, and the budget we are expending this year is 700,000. Is that the figure that is the annual budget you're talking about, not the overall budget? Just clarifying.
So in the annual budget, so that section, it's been reduced from the mental health and wellbeing. It's been reduced. It was initially supposed to be 1.5, and then in the final budget, it was chopped down.
Okay, so therefore, we do not think that will impact on our ability to hit our target of 250,000 mental health wellbeing champions. So far already, we are now at 85,000. And therefore, we feel that over the next 3 years, hitting 250,000 will be achieved. So the reduction in the mental health budget that you indicated, I don't believe will have a material impact on our ability to hit our target.
Thanks. And Vicky, we were talking there about the healthy weight, and obviously, but by the time children getting into reception, the figures for this year show that there's more children that are obese and overweight in London. In fact, it has risen across the country, but the jump in London has been much more stark. So clearly something's not quite working. What more can we do as the GLA?
So it's concerning, remembering that a smaller cohort of children, young people were measured, and that was in school. So in part, it reflects the children that were in school at times when the child measurement programme was undertaken. It's the extent to which that's an indication of widening inequalities and pressures, access that young children had to open spaces, the ability to be physically active, etc. So undoubtedly, yeah, time to redouble efforts on that outcome.
Thanks. And Joe, Joanne, turning to you, I should say Joanne, given Joe over there. What action has the Mayor taken to support young children in response to the impact of the pandemic, and how effective have these measures been?
Thanks. Well, Tom's already talked about the Healthy Early Years London programme. The team that I've been working with, we've particularly focused on early years settings, and I think a lot of that I will talk about in the next session. So about the early years campaign, about our stronger early years work and our hub work. But one specific thing I can say is that one of our hubs, the Mayor's Wandle Early Years hubs, we gave some additional funding to during the pandemic, and they piloted work to support social, emotional and mental health in early years in response to the pandemic. And out of that, they've developed a Nurturing Future Minds website, which I would ask all of you to have a look at afterwards, and we can send the link. But that was a very useful resource which was developed for practitioners and also for parents across London. And it's got a wonderful range of resources how parents and practitioners could support early years children. And we've promoted that on our website. We're continuing to promote that throughout our stakeholders and our events and newsletters. So that's a specific thing, yeah.
Thanks. And I'm particularly interested, especially, obviously we've talked about the development gap when we, I think it was Tom was outlining how that development gap leads to predicting school exclusions. School exclusions leads to youth violence very often. What interaction have you had as a Deputy Mayor with the VRU, and what involvement is there to support under fives? Because that work, that preventative early intervention work, must start at that young, and if it hadn't before, it's going to become even more important given the COVID cohort of children.
Yeah, well, I sit on the Violence Reduction Unit Reference Group. So I do work with LIB, and the Children Young People's team actually works with me and with LIB as well. So there's a very good cross fertilisation of ideas. So a lot of their work has been particularly around vulnerable children and their parents and parenting work. So perhaps after this meeting we could send you a little bit more information about the range of that work that the VRU has undertaken and which families in particular they've supported. But again, it is targeted toward the groups of children that Tom's identified and that you've identified as well as needing that extra support.
Please, I find that really interesting to see more of, because whenever I've looked for, you know, I know that obviously you sit on the board, but when I've looked for the programmes that from the VRU to help under fives and their parents, I've not been able to find that. So yeah, I'd really appreciate that. I think some of it is, a lot of the programmes are particularly supporting age 10 and up, but they will have younger siblings as well. There's also a range of programmes that are taking place in communities that are all age programmes supporting communities to help their children as well. So we'll try and get you some further information. Thanks.
Thank you. I just want to, I'm mindful that Dr. Coffey has to leave. It sounded like you wanted to make a really important point also about air quality before, so happy for you to write that in, because we should be taking all evidence that people want to.
What it was that recently that the poor air quality we now are aware has an impact on children's development, and that was the link I was trying to make. Is that, and so and also, as we know, the poorest Londoners live in the area in the areas with the poorest air quality. So there is a direct link between air quality and children's development, and therefore, and the health and equality strategy is one of the areas which was one of the 5 showcase commitments and remains as such, because we now know we've got hard and fast evidence to link poor air quality with poor development.
Did you have another bit of a question to come in?
Yeah, and the reason why I didn't, just one more question, but the reason I didn't want to touch on air quality now is particularly because we're talking about the COVID impact on covering. Obviously, if we saw anything, we saw that with COVID there was cleaner air in some parts. So that was particularly why I said no, not because I don't think it's important, just for this time. Just the final question was for 2019 to 20, it was 450,000, and then into 2020 to 21, it went down to £233,000. So almost a 50% cut in the funding to early years programmes. Can you explain that and how that's?
I mean, the total funding has actually risen quite dramatically. So if you take into account the workforce issues we're dealing with, for example, the ESF programmes to support people into early years careers, or the AEB, we're talking in the millions. I think our hub work funded finished in 2020. But looking at the figures, we're still investing significantly in early years work. I think the pandemic has obviously had an effect of the work we could do, and we actually turned our work to the sustainability of the sector, which we're coming on to in the second section. But it's quite clear that what we need to do, and we don't have such responsibility, so what we need to make sure that where we can, we use what levers that we have to actually have an impact in the sector, and we do that with and co-produce it with the sector as well. So we think we've actually had very strong programmes that have delivered real impact. So I don't think the budget is necessarily the best way of looking at it, although we are still spending significant monies in there.
Thank you. Thank you for all our panellists for the first section of our meeting, and thank you for your contributions today. We will now take a short 10-minute adjournment to allow everyone to have a comfort break, but also allow us to get the technology right, because we have some panellists joining virtually for the second part. Welcome back to the Health Committee. We are now moving on to our second panel to discuss the impact of the pandemic on early year support services. I'd like to welcome our new guests joining for this section. June O'Sullivan, MBE, who's the Chief Executive of the London Early Years Foundation. And joining us remotely, we've tested the technology during the adjournment, so we know it works. We've got Jonathan Broadbury, who is the Director of Policy and Communications at the National Day Nurseries Associations, and also Stella Zielkowski, who is the Director of Quality and Training from the same organisation. And we have Sarah McMullen, who is the Director of Impact and Engagement at the National Childbirth Trust. And thank you to our guests from the first panel for remaining with us. We have Joanne McCartney, who is the Deputy Mayor of London for Children and Families, and Vicky Hobart, who is the GLA Group Director of Public Health and the Deputy Statutory Health Advisor. And also Joe Lane, who is the Head of Policy for Action for Children. Just mindful that one of our guests also needs to leave. Sarah needs to leave at 4 p.m, who is with us virtually today as well. So I'll move straight on to the questions, and we'll start off with one from me. So how important are earlier services in closing the gap in the development of disadvantaged children and their better off peers? So I think we'll start off in the room first. I'll start with June. Not yet, no. So if you press the button with...
It would help if I pressed the right one, so that's a really great start, so thank you for that. So the question is how important is early years to children's opportunities for levelling up, and it is extraordinarily important. There are a raft of research that has been done internationally in the UK to support that idea. So if you think in terms of just very basics, good quality early years settings have a part to play in children's acquisition of language, which sets and train the most important ability, which is to think, and therefore to be able to integrate concepts that are abstract so that they can actually develop their skills for school. It helps them with their personal, social and emotional development, which is pretty significant in terms of their management of their own abilities to self-regulate and to manage their own emotions and build relationships and build friendships. It is quite significant actually in their health. So it's in terms of their physical development. In a really great setting, to be able to access highly nutritious, well-considered food is quite a significant factor, and you might want to come back to that in a minute because it's actually got a real implication for London. This is all based, though, on the premise that the quality of the setting is important. So a child who's attending a poorer setting, so in London, for example, 1 in 30 children can access a outstanding nursery in an affluent area, whereas only 1 in 10 can access an outstanding nursery in an area of deprivation. So when you're thinking about levelling up, you also have to think about not just the delivery of the experience the child has, but also where they're based, and then the structure around them, so how they're funded, where they're set up, and how they're supported. So yes is the answer. Early years is significant in terms of a child's opportunity to level up, but unless the quality is significant and the structure is around that in terms of supporting parenting, well-trained staff, there are 3 angles to quality. One of them is well-trained staff, one of them is good ratios, and one of them is a strong pedagogy. So if you haven't that overlaid on the service the children have, there's a risk of actual double disadvantage, especially if you're coming from a poorer community, more deprived background, or a more vulnerable child.
Thanks. Joe, do you have anything to add to that?
Excuse me, Chair. If you don't mind, I just wanted to go back, if you don't mind, just on those figures. You said 1 in 30.
This is from Ofsted. So this is an analysis of the Ofsted statistics. So a child living in an affluent area has 1 in 30 chances of going to a nursery that's outstanding, whereas a child living in a more disadvantaged area has only 1 in 10 chance of attending a nursery, an outstanding nursery.
Oh, okay, I got the figures the wrong way around. Thank you. Thank you.
Can I just
Sorry,
add,
Vicky.
though, if I can, that actually 96% of children earlier setting in London are in a good or outstanding. So the quality provision in London is very good. But the outstanding, yeah, those figures are there.
Thank you.
Could
Councillor Russell?
Sorry, could I just check those figures? So 1 in 30 in an affluent area, or 1 in 10 if you're in poverty. So we are focusing the good provision on the children in poverty.
No, the other way around. So there are fewer places for children in outstanding nurseries who live in disadvantaged areas. If you live in an advantaged area or an affluent area, you have more chance of going to an outstanding nursery. Simply,
Okay, the numbers didn't quite stack up with
sorry,
that. I think it might, they may have been reversed, but that's just good to have that clarified. Thank you.
Yeah, sorry to both of you on that.
No, thank you. I think, we're a lot clearer. There was a point about the 1 in 30 and 1 in 10. I think it was the other way round when you spoke it, but
sorry.
That's fine. Joe, do you have anything to add to that?
I think and I slightly made this point earlier. I think the only thing to add to that on early years services is to think of them in a broad sense rather than a sort of childcare sense. So Action for Children delivers both sort of nurseries and childcare settings, as well as things like children's centres and family hubs, as discussed earlier. And if you look at the sort of predictive models of which sort of things and experiences are good, give you a good idea of how a child their outcomes at age 3 or age 5. So absolutely sort of attending childcare setting, the duration you attend a childcare setting and the quality of that setting will make a difference. But things like the quality of the home learning environment, things like whether the mother's level of qualification are very important, the parental relationships and parenting style are very important. So when we think about the sort of support that somebody needs in those years 0 to 5, definitely that there's good evidence that attending childcare setting, attending it more and attending a good one helps, but also those services that are supporting parental relationship, parenting skills are absolutely crucial as well. So we should just take that sort of broad view of what do we mean by early years services.
Thank you. We're going to move online to Sarah to see if you have anything to add on this.
Yeah, would really just like to add to that last point, actually, to say that we do need to think about early years support in the broader sense and also at a much earlier age than I think often early years is discussed. So remembering that the first 2 years of life are absolutely critical for social, emotional and development for baby and the relationship and well-being of the parents. And that's a huge determinant of long-term health and well-being outcomes for babies and for their wider families. So I think just to make the point of having that really broad view, and we know that the sort of community support and statutory services during those first 2 years of life have been really heavily hit during the pandemic. And that provides a really important early safety net for families to get the early support they need, with really long-term consequences.
Thank you. And staying online, Stella?
Yes, so I just probably wanted to add a little bit about some research findings. So obviously agreeing with what everybody said, but thinking about, how missing out on nursery due to COVID-19 has affected children's development. And there's quite a lot of research, but some specific research that I'm happy to share the findings with you, the links with you. And this was carried out with both settings and parents, but this study found that children attending during the pandemic had a really positive impact on speech, understanding and thinking skills, as Joan was saying. But they saw that where a child was regularly attending nursery, even for just 1 day a week during the pandemic, that they had they understood 24 new words more than children than the peers, compared to the peers that weren't attending. So there are some really sort of important bits of research that will help to sort of understand some of those inequalities, especially where we know that children from those more deprived areas, specifically the 2-year-olds, didn't take up the places during the pandemic.
Thank you. It certainly, I think, matches with some of what we heard this morning about the impact of early this afternoon on the impact on child development. Jonathan, do you have anything to add to that?
Nothing really further to add now.
Right. So I'm just going to move on to my next question. So research has shown that COVID-19 led to a substantial reduction in the number of young children who were accessing earlier services. What impact has this had on their development, and what could the long-term impact of this be on later childhood development? I'll turn to our new guests, if you like, on this, because I think there was some crossover on the first session. So starting with June again.
I'm going to talk specifically about nurseries, and I'm going to talk specifically about my experience, and we're the largest provider of nurseries in London. And we're a social enterprise, so therefore our target audience, if you know what I mean, is actually across the piece, where we're very much also looking. 77% of our nurseries are in areas of deprivation. So during the pandemic, we kept 15 of our nurseries open for key worker families, but the criteria that was set didn't allow for us to bring children in what we would call in need into our nurseries. So that meant that they didn't attend. So we did a lot of family support and outreach and all the other stuff, virtual stuff, and sending home packs, food packs home, dressed as home learning activities and stuff, and all of that. But effectively, in the summer, when we were allowed to widen the opening, we worked really hard to get some of the children from the more deprived and disadvantaged families back. There was two reasons for that, really. One was that there was huge economic anxiety in those homes. And so people were terrified of getting COVID on the basis that their partners were often in the, you might call it the gig economy, that insecure economy where they can't plan. And the anxiety was really high that if they were ill, then nobody would bring money into the house. And that was a really powerful message we got from parents. And the second was a real sense of isolation and depression which had come over people, and they'd lost quite a lot of their sense of bravery, I guess, and they were scared to come out. And so some of our children had spent the entire first year in lockdown, locked in to flats with no outside access. So when they came back to us, we saw quite a range of responses. So the language was most definitely affected. The ability to separate was, again, unsettled. So it was a kind of a huge separation anxiety, not driven necessarily because of a strong affinity, but because of a sort of a sense of fear that had been transferred from parent to child. We saw an increase in obesity. We saw an increase in oral health. We saw children unable to learn to eat. So we're very keen on food. I don't know if you haven't met me before. We're very keen on food. We've set up the first Early Years Chef Academy. We believe that one step towards addressing obesity is to train chefs in nurseries across London and across the UK to actually provide well-balanced, nutritious, properly portioned food. And of course, we think it's very important that children learn to sit and understand the social experience of it. Sit with everybody else. We don't have high chairs or any of that. They're all part of it. And I'm very fussy about, nice cutlery, nice plates, and flowers on the table. Sort of the whole thing is a nice experience. But when they came back, they clearly had had none of that experience at home. And so a lot of them were unsure how to eat. They were, they took a while to adjust to proper meals. So they were used to sort of takeaway food or cheaper processed food. And so we had to work really hard to get them to sort of get used to all of that. We saw children going backwards in terms of going back into nappies. In the general personal social development, we saw delays in terms of them. They, hadn't learned how to navigate. So some children were on their own all the time and just given their phone or whatever it was and just kind of let to get on with it, where parents were really under stress trying to, do some work at the same time. Some children had learned to fight their corner in the house, so they weren't really very keen on sharing with anyone at all. And some children were very distressed by the whole experience and had picked up that level of anxiety. So what we did to respond to that was to I'm not allowed to, I don't know whether I'm allowed to say this or not, but I'll say it anyway, but was to challenge the government's 15 hours free access, so-called free access to those children who are disadvantaged, and doubled that. So we doubled that, we raised money and doubled it, so we could at least give them 30 hours. That proved to be beneficial in terms of they had longer with us, so we could, reintroduce food and nappies and all of the sort of basic stuff first, but also their parents could have a bit more time to actually sort of in a sense, reacquaint themselves with their locality, try and maybe do a bit of work, try and get the shopping done, all that sort of stuff. Because 15 hours, by the time you've dropped off and collected, it's really not a lot at all. So it was very interesting to see the immediate impact of COVID on what you might call the baseline of children's development: language, physical development, and personal and social experiences.
Thank you for that. Moving online to Sarah.
Yeah, so just to add to that, really, I think there's a need for much greater recognition, I think, of how all of the sort of cumulative stress of what's being described there, the poverty, the increased exposure to trauma, to financial and housing insecurity that we saw during the pandemic, heavily impacts on parents' capacity to be responsive caregivers, to give their babies and their young children what they need as they're developing. So that home learning environment that was referred to, and this is right from the smallest of babies through to, entering childcare or starting school, there's a really cumulative effect of all that stress that affects parenting capacity. And I think there's lots of good evidence and research there about what can help, both in terms of statutory services and specialist support available, but also the importance of community support, of social connection, of being able to get out and build relationships and build trust. And often those sort of safety net community services provide the first step to talking to people for issues to be identified and for people then to be able to access early support and early intervention. And I think all of the parts of that system were affected during COVID, and we've seen a real fracturing of it, and actually recoveries being really, really slow. And so for the parents and families who are at the centre of it all, often the only way of joining any of it up is them themselves. And if they're in those incredibly stressful, challenging situations with lots of barriers to accessing that support, it's not fair or right that the expectation is on them to try and join it all up and find their way in and find their way to the support that's available. I think what we're finding in our community services is an example from our project in Newham. So we have the Newham Nurture project, which is currently funded by the Department of Health and Social Care, and that's a local community partnership with Alternatives and the Magpie Project and Compost London. But what we're finding there is that there's sort of volunteering support and the counselling and family links workers are doing a lot of that support of linking up, of bringing parents in to support for the very first time with a 2-year cumulative impact of COVID-19 in very challenging personal circumstances. And they're helping to build that trust, build the access, connect people into services, whether that is about insecure housing, domestic violence or financial insecurity, whatever it is, they're acting as the connectors. But these really precious sort of grassroots, volunteer-led community services, I think, have found it really difficult to be resilient to the pressures of COVID. And I think that's where a really sort of joined up local leadership and strategy can really help to make sure all those sort of support, community and statutory services are working together in a much more joined up way.
Thank you. And Stella and Jonathan, do you have anything to add from the association's perspective?
Just to add, in terms of some of the difficulties, following on from what June was saying, their children settling into nursery after lockdown, saw lots of sort of challenges with that, and some of the children had not been in contact with any other adults during lockdown apart from the parents. So there was, I think there's a big importance in terms of the workforce and making sure that we've got a strong and supportive and knowledgeable workforce. And they sort of had to go back to basics at that point, with children, rather than trying to, to focus on too much on development. It was about settling them in and getting them all ready to sort of, and accepting to learn at that stage.
Thank you. I'm going to turn to Assembly Member Russell.
Thank you, Chair. My question is picking up on digital delivery of services. And I'd like to know what proportion of services that were delivered face-to-face before the pandemic but started to be delivered virtually during the pandemic are still being delivered virtually, and whether there are some services that can continue to be successfully delivered in a hybrid way, and whether there are some that really can't. I was going to go to Sarah from the NCT first, particularly because someone I know who is accessing maternity services at the moment has told me that it is surprising how much you have to do on your smartphone, and they were just very aware that some people don't have a smartphone, and so wondering if there was a digital exclusion, health inequality issue there.
Yeah, I think this is a really important point. I think, there's been some amazing learning and some amazing innovation during the pandemic, and we have seen instances where having access via screen and digital can add value and can be really helpful. However, we've had a really significant concern over both digital exclusion, so people who literally can't access the services if they need to have data and devices to be able to do so, and that is a very real problem for some families. But also that even if they can access the data and the device, it's incredibly difficult to build relationships of trust, and it's really difficult to identify when there are issues, whether that's with parental mental health or domestic violence or child neglect, for example. And I know we've seen some examples, and there's been lots of discussion around how important it is to get our the sort of key contacts, health visiting, for example, key contacts and key services back in person, so that those relationships can be built, and so that early identification can be strengthened again.
Well, I would
come in on this.
Echo quite a lot of what Sarah said on that, and our experience was at times quite distressing, actually, where there was no face-to-face interventions for children in need, and we had to fight quite hard, actually, to get some children to get access to support and services, who would otherwise have been actually in quite a lot of harm. I think the whole thing about relationships is really important. So to start with, it was kind of slightly quirky. You're doing this online. Some people could do it, some people couldn't. And the children were a little bit bewildered by it, but they figured it out. They didn't like it after a long time. It didn't work for them. So yeah, we'd have our key workers all singing, and everything else, and parents mega relieved to get a little bit of a break for this. But it's not something you can sustain in the long term. In terms of staffing, interesting. So we've always been kind of keen on the blended idea, but I think we need to kind of refine what we mean by that and how much of their learning can be done using effective. I think there's a real piece of research to be done around what we mean by blended and hybrid. I know every business in the land is looking at what they mean by hybrid, but when care is your business, it has a different narrative. And I think some of my staff are actually quite sort of sad, really, that we're all back to normal, because during COVID, when they were open, they were like nobody on the train. They could get to work safely. It had a different vibe, and also the children were more relaxed. I mean, you might think that's odd, but when you have fewer children, they could do more with them, they could be more engaged, they could have more quality time, there was more talking, there was more nurturing, all of that sort of stuff. So all that kind of stuff that we don't always value in relation to education, because education is based on care, was, I think, revalued. So I think there's a bit of, it's probably a useful thing to do a proper dial in on what we mean by digital, and also a lot of our parents didn't have any access. So we were ringing them in the traditional old-fashioned idea of picking the phone up and having a call, standing at the door and coming away from the garden. So you had that 2.5 meter thing, because they didn't have, we knew they didn't have phones. Or there was one phone and they had children who were at school and they had to have priority on it because it was the only way they could get access to schooling. So a very interesting, and I think it'd be very interesting to look at it through a London lens, and not just a London lens, but a borough lens, because the learning for us as well is London is remarkably green. And I think it was about finding those green spaces and then creating opportunities to bring people together. So we did quite a lot of that, of kind of nurturing groups by saying, that they would be in this space. We had the half-an-hour walk thing and all of that stuff, where you could actually kind of connect with people. So a lot of people became more familiar with their own areas, but they needed that network, and we helped to build a network. And I think some of the learning from this is that actually, and I mean, I'm a little bit obsessive about the whole London thing because that's where we're based, and it's my chosen city, etc. But it's the sense of creating the nursery as a community catalyst. So and I think we could do some more work on that actually, and really deepen our multi-generational element of, in our case, our pedagogy, but we can frame it whichever way we want. But in terms of bringing people together, connecting people, and using the nursery as a neutral space where no matter where you come from, your children are playmates, and therefore how do you then use that as a place where people come in? It's interesting to hear Sarah talk about health visitors. We haven't seen a health visitor for love nor money for a very long time. But don't blame the COVID for that. That went on beforehand as well. They weren't around then. There was a policy decision to, I think, increase by 4,500 across the country. I don't think that was ever met. It's not to say that they're not important. I'm not saying that. But, they're not a species that you see very often, I think, across any plane of London. And we have 40 nurseries. So, there's quite a lot of children go through our hands. And when, the days of when you all knew the health visitor, which there used to be, is long gone from that point of view. So I think London has could have some very interesting responses to how we use the city, the sort of sense of the living city, and how we might use that much more as community catalyst, and how we can also use the nurseries by just spinning them a little bit as to how they could become much more catalysts for community engagement.
I can
Thank
see
you. Just,
Vicky. Sorry.
Sarah's itching to come in online, so she had a hand up.
Can I? Okay, yes, go for it, and then but I want to bring Vicky in on something that June was just saying.
Thank you. I'll make a quick point actually about the importance of green space, because I think that's a really important thing in the recognition of how much green space there is in London. We ran walk and talks during COVID under exemption from legislation to bring new parents together. And we had over 50,000 parents attended in that first year, and 100 of our walks were running in green spaces in London. And it was incredible at that time that families were coming along with their babies and their toddlers and saying, this is the first time that my baby has seen another child. This is the first contact. This is the only time in the week that I can come and I can talk to someone. And often those conversations are really important and valuable and help people to think about what's going on and process it all and get them into more specialist support as well. And I think even though that was a moment in time, that was in lockdown, etc., I think there's loads of learning there about the importance of green space, getting people out of the house to a place that feels safe and okay and non-judgmental and not services, but actually it's a place where they have their first conversation. So I think there's lots to build on there, and love the ideas of nurseries as hubs, connecting all of these amazing support offers as well.
No, so that sounds like positive learning to come out of a very difficult experience, and there's quite a lot of work going on in quite a lot of boroughs, I think, on kind of thinking about green space on prescription and access to it. But I just wanted to go back to the digital points that we started on, and the kind of the difference between digital and hybrid delivery of services. Because Vicky, I saw you writing notes while June was talking, and I was just wondering, there was the point about research being needed, and I just wondered if that was something that you could suggest who might be good to be doing that research, or whether you know if that research is even happening.
So I don't know if it's happening. I'm more than happy to pick that up with the committee afterwards as an action to see what's happening in that space. I think it's a key question. It's enabling, isn't it? In some ways, a number of services, as June said, are kind of grappling with this. The Red Book and the Governor Andrew Lebson's focus in the first 1,001 days includes a digital element to that, communication between services. So it's a really important and live policy question, I would say, at the moment as well.
Great. Well, thank you very much for picking up the point. Joe, did you want to come in?
Yeah, I was just going to add that I think one challenge we face as a sort of early years sector is the problems of COVID are sort of overlaid on quite a confused approach to attendance generally. So the government has been very robust on attendance at schools, so it's established a new attendance task force and is talking quite sort of punchily about ghost children. In early years, we're much less confident about what services we think children in the early years should be accessing, and in lots of instances we don't measure or record the services that they do access. So whilst millions of children are still using children's centres, nobody knows exactly how many, and nobody knows which services they're accessing at those children's centres. So in many instances we're blind, and that sort of research should happen absolutely in terms of understanding the impact of COVID, but really we should be in a much stronger position just as a baseline of understanding how our young children are sort of benefiting from public service access, and that's something that can happen either at a borough level, at a London-wide level. Could that data be collated from boroughs so we have a London-wide picture of the early years services that children are accessing? And on that digital point, so we did some research on your research point, we did some research with parents about their access to early years services. The thing we found was COVID had definitely exacerbated parents' frustration with being unable to access early years services. But not as by that much. Parents were already very frustrated about not being able to access things like baby and toddler groups, parenting skills programs, parenting programs. So there was already a sort of latent problem with parents really struggling to access the help they want, though they did highlight only being able to access things digitally as one of the common barriers. So parents very commonly said, the reason I couldn't access the service I needed was it was only offered in a digital setting. So we absolutely need to understand the sort of demand function of what parents, because we're not going to force parents to access it, so we have to respond to the way parents want to access services. And of course that needs to be balanced out by the positives, but there's definitely the sort of producer interest type, disincentive that we don't want to, sort of laud ourselves for building brilliant digital programs if parents are telling us they want something else.
Mm-hmm. Thank you. Thank you very much. It seems certainly for the committee that there's a point about data and research and actually understanding, these sort of changes in delivery of services that came through the pandemic, that actually we try and find out if anyone is doing that research, and certainly Vicky, anything that you can send through to the committee would be really, really helpful. So my next question...
Would it be possible, Chair, just to ask a very small question there,
yes.
What Mr. Lane was saying?
Yeah, it sounded like, Andrew, it's on a related point, so...
It's absolutely on
yeah.
what was just said. Do we not record who uses children's centres? I mean, you give the impression as though kids are just wandering in and out and we're not making any note whatsoever. Is that the case?
No, I think we do record it. If somebody's seen that data collated into a sort of usable sort of statistical data, then I would love to see it, because that's something that Action for Children does quite regularly as we try to build that picture. So Children's Centres will be collecting it, local authorities may be collecting it. My understanding is they don't publish it and nobody is collating that data. So we don't have that clear picture of saying, last year 2 million children used a children's centre, and the year before it was 2.5 million. And that would be very beneficial for understanding the sort of the way public services are interacting with young families.
So local authorities need to collate that. Presumably they should have that data, the local authority.
Yeah, hopefully, I think that's right.
Thank you.
Thank you. So my next question is about the impact of the pandemic on early years services and early years providers. And certainly as a counsellor in Islington, I visited my local children's centre recently and heard that there were parents who were working remotely or had lost hours during the pandemic, or who were kind of juggling jobs where without sick pay and therefore kind of struggling to kind of make everything connect up financially if they had to self-isolate, for instance, that they were wanting to have different hours, that the kind of the traditional model of childcare hours was not working for them. And I witnessed a parent trying to change her hours, and actually it just wasn't going to be possible because the financial model didn't work for the centre. And so I wonder how many providers have not survived the pandemic, and what is your view on the long-term impact of that? And if I start with Jonathan and Stella, and then I'll come to June and then Joanne. Jonathan or Stella, because you're one organisation.
Yeah, I can pick up on this one because we have done quite a bit of research on the impact of the pandemic on providers, especially sort of nurseries and preschools in the PBI sector. So Ofsted data showed that over the year of the pandemic, so the main sort of 2020-21 year, there was a net loss of over 400 early years settings in terms of those nurseries and preschools. And when you look at childminders as well, that runs into the thousands. So there's been a very clear impact in terms of whether settings could even survive, and we did our own analysis on the figures that we have through our membership and through publicly available information, and we found that 21% of the closures we looked at were in London. I think that splits between just over 11.5% in outer London and 9.5% in inner London. And then when we widened that to London and the broader southeast region and brought in some of those traditional sort of commuter areas, that was nearly 40% of closures in that year of the height of the pandemic was what we called it, even though we know that there were subsequent spikes after it. And going back to the very first point, which was about the attainment gap, and June referenced the difference between more affluent and less affluent areas, and there was a clear skew in terms of closures in the disadvantaged areas. So 35% of closures happened in the lowest 30% affluent areas. So availability of provision in those areas was badly hit. And when we asked providers about their financial situation as they were coming out of the pandemic, 46% of our members in those areas of deprivation said they were expecting to operate at a loss over that financial year. So there was a significant impact on settings' ability to operate and open. And that relates to things like the complexity of the areas of support that was available when they looked at the funding that they got from government and the furlough scheme and how that interplayed. But actually, on top of that, whilst there was additional support for schools in areas like cleaning and staffing support and all the other extra things people had to do during the pandemic, there wasn't the same support for those childcare providers outside the school system. Settings were a very different environment. They had to limit the number of children. So even after the first sort of 4 months of that original lockdown, when settings started to open up again to all children, it wasn't just then a free-for-all. There was limits on the numbers of children they could have in, how they worked with staff and kept to small groups. So that will have had an impact on children's interactions, but also when you're looking at the fundamental business model, it was very difficult for people to operate in a sustainable way. And what we saw is over the course of the pandemic, a real erosion of reserves. And I bring that together both in terms of human reserves, so the reserves and the well-being of the staff and the people working in those settings, and the financial reserves, whether they're private, whether they're community interest companies, however those providers are set up, there was a real hit to their viability.
Thank you. June, did you want to come in on that one?
I think Jonathan has summed up very well, and I was pleased to see that my 9% and his 9% aligned, so we're all right on that. So that's for sure is definitely 9%. Just an aside, and I think you need to check this, but when we were working with Magda during the COVID to try and get a sense of what was happening in London, what we discovered was, and again you need to check this, but that there was no protocol with the DFE, so we couldn't get statistics, and we couldn't get a kind of London focus on the statistics that they collect. So we were looking a little bit in the dark at some of the analysis. So we certainly saw that in the areas of deprivation there was much more pressure on the nurseries there. In terms of the government recovery fund, only 3% was allocated to the early years of the whole fund. And that really didn't go very far, particularly. Yet, in London, I think the last time I looked, there was 5,126 nurseries in London. We saw a 3% uplift in areas of affluence. So I don't know how much you know about the sector, but it is not one you design if you were starting from now, let's put it that way. And about 12 to 15% of it is large groups. Now, I agree, we're a large group, but we're a social enterprise large group, but the rest of them are tended to be leveraged by private investors and overseas venture capitalists who put a lot of money into to the buildings and raise the value of their assets quite substantially. And we saw the 3% has been in that area. So you go to places like Richmond and Balham and areas of high gentrification and increased population of more professional families, you saw an increase. But in the other areas, you saw a decrease. So, for example, in Newham, we took on 3 nurseries that would have gone bust if we didn't save them in the middle of COVID, and that saved 200 children. Places for those children that would have happened otherwise. So there was a kind of it's an odd picture, and I think you need to understand the two ends of the so-called London market, and what happens in between is important. In terms of staffing. So I mentioned to you earlier that, during COVID, quite a lot of my staff were, okay, apart from COVID, they were actually quite having a happy time. The children were having a happy time. We used to call them every day at 3:00. It was calmer. There was fewer demands on them. Yes, they were a bit more scared, but they created this they kept telling me they had this kind of like little hub of happiness in their nurseries. They kind of felt like they were in this particular safe world. Since coming back, of course, you have all of the staff are all back. But we're so short-staffed, it's beyond, it's just the worst I've ever known it. And I've been in this game for over 20 years. And it's bad at both ends. It's bad in terms of attraction, and it's bad in terms of retention. Now, we've unpacked the whole journey from, attraction all the way through. We're all drilling into every level and process. We're not just sitting there thinking, oh, it's just terrible out there. We're doing an awful lot of work and stuff. So a couple of things I think have also significantly hit on that. And your point at the beginning about flexibility. So the staff want the same flexibility as the parents do. Yet it's impossible to run a nursery on that basis, it's really, when you think about ratios and allocation. And I am very not in favour of the government's view that you simply increase the ratios and that's going to solve the problem. There is no research to suggest that one way or the other. And it would just put more stress on the staff. Plus, generally as a country, we should like our children and therefore give them the best experience that they have when they attend a nursery. It's not a dumping ground. It's an experience that they should enjoy and thrive, and we should be proud of what we do. So therefore you have all of those things now coming together, sort of post-COVID response, post-economic response, cost of living response, all of those things are sort of loaded on their heads. Set aside, then the status is lower. It took a long time for people to clap for the fact that they were all getting up in the morning and going in and running nurseries. It took a long time for kind of an acknowledgement. It took a long time for people to recognise the kind of demands of the job and, not just the children's needs, but parents were equally needy. I mean, sometimes more needy than the children in terms of the way they responded to being on their own and being lonely and being isolated and all of those things. So, it's not the easiest position. But I think to Sarah's point, I would say we totally support the idea that for some, the only contact they had was the nursery. Like the only contact, and some of them had children during that period, and those little babies are now what I call the Covert babies. And I think London really must do some research to look at the status of babies coming to us who have been born into a weird situation where they haven't really been around a lot of people, where they've seen a lot of adults wearing masks, where children's language is acquired by looking and you've not seen, and where there's whole sort of anxieties and separations and insecurity now compounded by the economic situation. So there's some very interesting things we can do in London to kind of unpack some of that stuff, on the basis that London should be the best city in the world for a child to grow up in. And that if you start from that principle, then, what do you need to do? So first you have to raise the status of the staff. And that's kind of hard because the funding is lower and you have to do what you can to pay more. And there is a horrific bidding war out there now amongst competitors. And we also have a new generation of people coming in who have a different attitude to the work experience, who have got a different approach to how what work feels like for them and what they want to experience. And we have a large, a kind of deeper need for additional support, not just in terms of the teaching of the children and the pedagogical kind of approach to the children, but in terms of the home learning and the experiences that people are also wanting as part of the overall package. And it has been, and the reason for that is it was aggravated by the government guidance, which we all followed. And I'm not complaining about it, it was what it was. But you couldn't let people into your nurseries. So you were settling children. I mean, it's kind of like a leaf out of The Handmaid's Tale here, that you would arrive in the morning with a baby, with a mask on, in a queue where you didn't touch the person for 2.5 meters behind, and you handed your baby over to an adult who had a mask on, who took this baby in, and then you trusted that that person would be able to, care for and look after this child. So the bond of trust was really strong, but really scary at the same point. So in terms of digital, that was important that we gave much more information on digital during the day that we never would have done before, because we needed people to see that their children were going to be well looked after. So that was very important in terms of message and communication. And it sort of shifted the dial really on the relationship. But it did mean there was a higher level of mistrust. The consequence being that then you had more complaints, more tensions in the relationships, which are now ironing out because people are now coming back in, and we're very delighted to see them back in. There is talk in some nurseries that they don't want them in because it was easier, but that's really not right. So there was some real tensions around all of that.
Get you to
sorry, I'm on a roll now.
Yes,
so, yes
I could listen forever, but I've got the
these
chair
are all the kind of nuanced
me.
things, yes, that are coming out of this. And all I'm saying is that in London, it would be great to kind of capture some of this stuff in terms of both the narrative, but also in terms of the future of the babies that are now attending.
That's really helpful. Chair, I had offered Joanne the chance to come in very briefly, just to give a London perspective on this. Could we just let her, if there's something
very briefly,
from that London...
what the clock is like, so yeah.
I'll be quick because I don't want to just reinforce everything that's been said, but the research that we commissioned from the Early Years Alliance and CEDA does also tell the story that it's nurseries and childminders in the most disadvantaged areas that are most fearful for their future. And so if I can just give you some figures which might help. This is in 2021, just 39% of private providers and 21% of voluntary providers were actually in financial surplus. For childminders, that fell to 19%, and nearly just over a third of nurseries and preschools were using contingency reserves to manage their finances. And half of childminders had used their own personal savings to keep going. So you can just see the extent of the financial precariousness of many of those settings. And June's quite right. The vast majority of settings are actually people who may be voluntary. They don't have the financial reserves of the big chains. And, you know, it is really precarious. And so we are concerned about areas of disadvantage will be suffering the most as well.
Joanne, is there anything that the Mayor is able to do sort of strategically to try and intervene on this? And maybe that's something you might want, and Vicky might want to come back to the committee on.
I can talk about our stronger early years programme now, or I don't know if you've got questions about that later on.
Later.
Yeah, so we did. We recognise that and we tried to intervene, yeah.
Thank you. I'm going to move to Assembly Member Dr. Sahota.
Thank you, Chair. My questions are primarily to June, but of course, Jonathan or Stella can come in if they wish to. June, is the supply of early years education currently meeting the demand in London?
If I'm just to answer very quickly, yes, we have a waiting list in most of our nurseries. We haven't got enough staff.
Okay, so the next question is.
So therefore, it's not really, but
no, exactly.
there is a
so
supply.
There are vacancies, but they aren't staffed to provide the services.
Yeah, I can't staff some of my waiting lists. I have to say.
So the answer probably is that we're not meeting the demand then.
No, we're not. We can't meet the demand. There is a demand.
Yes.
There are more and more babies who want to come. They're on a waiting list quite often simply because we can't get enough staff.
Yes.
However, in the more disadvantaged areas, there's a lot more local authorities could do to actually find those families and actually navigate them through, because the process isn't one that they come directly to us. If you're on the 2-year-old disadvantage, you have to go through the local authority. And some family information services and stuff, they're quite limited now. So I think if you were to really start to drill into some of the supply on children in need or children from more poorer families, you'd find the opposite effect. But I just think that we haven't found them, and that the services haven't identified them well enough and effectively enough for them to come to us. But in terms of more affluent, parents want to go back to work, they're worried about money, and so on and so forth. I simply can't always staff.
Jonathan online wanted to come in on this.
Yes.
Thank you, Chair.
Yes.
Yeah, it was just to say that I think you've hit the nail on the head there. In terms of yes, there is a lot of unmet demand from providers in certain areas because of the staffing pressures. But then when you look at take up of things like the 2-year-old funded offer, which is low nationally, I think it's around about 62% of those who are eligible are taking that up, and then there is a further problem in London in terms of take up, and the Quorum childcare sufficiency survey found that within London, local authorities were talking about, I think only 57% of local authorities had sufficient childcare for those under 2s. So already, I think there's two things going on there. There's the fact that we're not reaching all those who are eligible, and June's made a powerful point there about actually, these are the children who we know could benefit most from that formal early education and care, and proactively going out to find them, it should be a priority. But if there are plans to do that, we have to acknowledge that with the workforce crisis as it is, there's just not the capacity in the system to do that. And going back to June's point, these are Covert babies. These are children who need more support, not less. And that's why proposals to change ratios, won't deliver the kind of things that are being talked about in the, nationally, but at the same time, actually, are they what we want to do, given the need for the extra support for those children? So it's kind of a double-edged sword. Yes, we want to increase uptake for those children who will benefit the most, but actually, because of the higher staff ratios, because of the workforce crisis, is there the capacity? At the moment, a lot of people are struggling.
And so what can we do to increase the staff recruitment?
Well, you could do a couple of things.
Yes.
So London could do a London-wide campaign, like, if you can teach, there's one of those big campaigns that's in every man across London, that's up on boards, that has got the mayor's backing, that has that could be really encouraging. The apprenticeship in London is very interesting. We take 100 apprentices at LEAF, and I think we could do more around that. We could do more about... London did this very interesting thing about the levies, where we did the partnership model, where we kind of could filter things through. We could do more about that. There's a real push at the moment on levies in the green space and in construction, but I think early years could do with it as well. And some campaigns, again, using the GLA brand, really, around young men into childcare, around young people who haven't done so well in school, but who, with the right nurturing and stuff, could improve. With some mentoring and some support, we could pull together some really interesting London-based organisations, particularly around mentoring and coaching, and actually filter them through a kind of like a seed hopper that would take us to the early years, where we could then do sort of introductory workshops, do more in schools, do much more in schools, and make it easier. Because at the moment, with the T levels in schools, there is a kind of push away from the early years. And I think there's much more around London parents believing that actually great opportunities, if you work in early years, that will lead you with real promotional opportunities and a long-term career.
So you think this is something which the mayor can help with?
I think so. I think the mayor could do a really good job on it, actually, yeah.
Maybe that could be one of the action points from the report. I'll bring in you come in, yes.
I don't want to be preempting later questions, but we are doing some of that already.
Okay.
So perhaps I can talk about it a little later, if that would be helpful. But our hubs, the 3 hubs we funded between 2017 and 20, did a lot of work around trying to attract school leavers in particular into the early years sector, and also around, and as part of that, about how they reached out to 2-year-olds to work with the local communities. And before the pandemic, they had actually upped the 2-year-olds take up in their particular.
So your assertion or your hope is that the early year hubs will address the underlying issues of recruitment, retention, and funding within the early year sector.
The hubs were a pilot programme to allow them to trial some new ideas and try to establish some best practice. And I think they have done that. So what the next phase is sharing that best practice. So at the end of last year, we produced a hubs toolkit, which shows how you can set up a hub to improve that practice. But I will also talk a little bit later, because I think you have later questions about our current campaigns and what we are doing.
Okay.
Just online, we have Stella and Jonathan who want to come in on this.
Okay.
Quickly.
Okay. I just want to pick up on the some of the recruitment issues that June's been speaking about, and we're finding since 2015 we had around 83% of staff that were qualified to level 3. This is reduced year on year from our findings and research that we do annually to 52%, and and that was in 2019, but whilst that's not the most up-to-date picture, we suggest that situation hasn't improved. And now I can only give you that from a national picture, but might it be helpful to do some research in London to look at the shape and space of the workforce? This staffing crisis that we've got has hit an all-time high. We've got nurseries that are closing because they can't get staff, and we've also got room closures. We've got people who are not taking on children. They've just stopped an intake of children because they can't get staff to deliver services. We also did some research between August 2020 and May 2021 with EPI looking at the impact of COVID on staffing. What happened as a result of some of the things during COVID? So, for example, furlough and staff being faced with a reduction of income, they were forced to find alternative employment. And when settings were ready to reopen, staff who'd found the alternative employment made that decision to stay outside of early years and not return into nursery, because some of these roles were paying higher. You know, they were getting more in places like elderly care and research roles. We carried out this survey quarterly, and we saw that there was a mass exodus from the sector. And so our final survey that was carried out in the last quarter showed that out of 344 settings, 260 staff had left nurseries, and they were voluntary leavers. And the majority of those were at level 3. That was the highest percentage. And we also asked about, you know, the ability to fill vacancies, and 94% of people responding cited that they just couldn't recruit because they were experiencing no suitable applicants coming forward. Now, I think just building on what June was saying about attracting more men into the workforce and building on, you know, the work that's already being done. Often when it comes to a point where they're school leavers can be too late. You know, that perception needs to be changed when children are making choices at 13 and thinking about careers, and maybe supporting more men into the workforce at that stage, when you can talk about those career opportunities and progression opportunities that are available.
Thanks, Stella. It'll be helpful if you could share those survey findings with the Health Committee, if you can send them in. That'd be very useful.
Yeah.
So just looking at the fact that we have a recruitment crisis, and on top of that, we've got the government's proposal to increase the ratio of nursery staff to, it's a double whammy, isn't it, in the sector? Would you agree with me?
I totally would agree with you, and I absolutely agree with Stella that the figures that she's quoting are, and the experience is my daily experience. I don't want to sound dramatic, but we are closing rooms, opening rooms, and I hope the campaign you're going to tell us about is really going to really hammer home, because we really need young people, like 14-year-olds, you know, starting to think about it now, because we have to build a pipeline. I was talking to Enfield the other day, and because I have this meeting with the local authorities on a regular basis just to share stuff, and she said that in their local college, normally they would have maybe 30 people completing the level 3. This year they were anticipating 6, and next year 8. So there's something about what we can do. I don't know what the mayor could do about that, but you know, whether we can encourage, I don't know the funding around colleges, but whether you can invest more, because what we're finding is that most now are teaching the Health and Social Care Award. They're not teaching the Early Years Award. So when you employ someone with the Health and Social Care Award, we have now created a conversion course. So you have to then train them back into that before you can get them out, because you can get someone qualified, but you can only have certain amounts in your ratios. Some things about the proportion of ratios is important. The idea of extending the ratios is just crazy, and it's just going to tip us over. But the experience of closing rooms, trying to not meeting the needs of parents that the other councillor was talking about flexibility, staff stress, well-being, all of that stuff, is a mammoth problem. And I think we need to be both creative, innovative, and I guess, be willing to put some funds behind investment if we're serious that childcare, and by that I mean early years, and I mean particularly in my case it's nurseries, but I know that there are other areas as well, but actually around that, if we see that as essential part of London's infrastructure. You cannot get people to work in London unless you've got a really decent network of really good quality nurseries that are accessible and affordable to London's population.
That brings me to the exact point, affordability. Because we have a situation where we have a lot of demand for nursery care early year. We can't staff those places we have. And then on top of what we have available, and there's only an uptake of 57%, right? Because the cost of childcare is horrendous in London. So what can we do to reduce that?
Well, you have to lobby the government, I'm afraid, because
what shall I lobby the government for? Tell me what I should be asking the government for.
Currently, we know the cost of an hourly rate at the most, at the minimum, I beg your pardon, of an hourly rate is about £7.48. We are lucky if we can hit £6, and so therefore, by a dint of a miracle, we have to make up that shortfall on hourly rate on children, and that's just for ordinary children, if you know what I mean. So then they have the disadvantaged group, as they like to call them, on top of everything else. They're not funded any differently, yet we are meant to also be able to account for those. What that means is your levelling up is not levelling up, it's levelling down, and your division between those who can afford and those who can't afford becomes wider, yet they're the very children that could benefit. So effectively we're underfunded. We've been underfunded for years, and they're short about £6 billion. So we're told all the time that the government's put £3.5 billion into the childcare sector support. I don't care. It's not enough. It doesn't cost. It costs $6 billion, so that you have to pay it. It's not the same argument about schools. We don't have petty arguments about the cost per child when schools are just simply funded. Yet if we see children attending nursery as part of their education, as part of their preparation, as part of their access, as citizens of the world entitled to some level of good quality education, per UNESCO and, the rights of the child and all of that, then we have to fund it correctly. So that's really the door. The Treasury door is where you have to knock.
And you use the word levelling up.
Sorry, I'll let you finish this final point.
Yes.
But Assemblymember Boff does want to...
Yeah, but can I finish the chair, please, with all due respect, okay? Now that I was in the flow of things, you interrupted me. But I was going to pick up on the word levelling up. You used the word levelling up. Do you think the mission of the early years and the government's levelling up white paper was a missed opportunity?
Completely.
That's a simple answer. Thank you very much.
Thank you. Assemblymember Boff?
I'd like to know from the Deputy Mayor, and you kind of edging towards answering the question I'm about to ask, which is how many courses has the Mayor delivered through his adult education budget? We know the figure. Well, we know the 2019-20 figure, which was about £3.5 million. But how many courses did that produce?
I don't have the figures with me, but I can certainly get the skills team to do that. But I do know that the skills teams under the ESF programme and also under the AEB, there are issues about filling the places and there are vacancies. And I think it goes to the point that this is a very low-paid industry, and therefore people have got different choices. And so the workforce crisis, on top of other issues we've talked about today, is really a perfect storm.
So there are vacancies within the courses where that money was... I understand that,
but I don't have the figures to confirm that.
If we could have those,
find that from you, yes.
I'd appreciate that.
Yeah.
I'll now move on to...
but can I say, there is a drive to get people into them.
Right.
Yeah.
How successful has that been?
I don't know. That's driven by the skills team.
Yeah.
So,
okay. Yeah. What has the impact of the Strong Early Years London programme been, and how is it being measured?
Early in the pandemic, we realised that there was a real threat to the sustainability of the early years sector. So we commissioned the Early Years Alliance along with CEDA to undertake some research. And from their research, they come up with some recommendations, one of which was for the GLA to develop a one-stop shop to bring greater coordination and accessibility to the offer of business support for the sector, and delivery of a programme of sustainability across London in the 2021-22 financial year. So the Strong Early Years business support programme ran from June 21 until the end of March this year. So that was the 1 year that was requested. It offered a range of support from webinars, local surgeries, to bespoke one-to-one support for the most at-risk early years providers. They were accessed by over 1,300 nurseries and childminders. We also created and launched an online one-stop shop for early years business support. And so far, that's attracted over 1,700 unique page views. Webinars were recorded throughout the programme, and they've been viewed over 2,000 times, and 246 early years providers have benefited from intensive support via one-to-one consultancy or repeated attendance at events. The project, although we commissioned it, the Early Years Alliance did work very closely with local authorities. They sometimes have their own programmes as well. So we developed a London-wide, and I'm happy to say that we had settings from every single local authority taking part in that. What are we going to do in the future is all those webinars are still going to stay on the business hub so that they can be viewed, because they do seem to be very popular, and they offer advice from how to attract parents, how to market, how to cope with your financial issues and so forth. So quite a wide range. One of the things that the Early Years Alliance told us, and I think this goes to the fact that most early years providers in London and the UK are not big chains, they don't have accountants, is that often they didn't actually know what they wanted, but they knew they needed some help. So I think the range of support we were able to give, both universal but also particularly targeted, and we targeted those nurseries who told us they were particularly at risk of financial insolvency, or those who are in disadvantaged areas for that intensive support. So going forward, we are awaiting the final evaluation report. That should come in the next couple of months, so I'm happy to send it to the committee when we have that. But the Early Years Alliance undertook a baseline sector survey. They're running new surveys and asking people for their views on the programme and whether it was helpful or not.
And do you have a record of how many nurseries and childminders there are in London? Ms O'Sullivan referred to a number earlier. I don't know if that was London specific.
Yeah, we have, I think, over 8,000 settings. I don't know the breakdown between childminders and nurseries, but I can certainly see if we can find that.
Ms O'Sullivan, you said
5,000. Yeah.
5,000 nurseries
yeah.
and 8,000 points of delivery.
Yeah.
Thank you. The Mayor published an evaluation report into the first year of the Healthy Early Years programme in 2019. Why hasn't he published an equivalent report since then, and how has he ensured ongoing monitoring of the programme? Yes, please, Ms Hobart.
Thank you. So, the development of the programme in 2018 that led to the launch, a lot of the delivery of that and the pushing out of that was through local borough colleagues as well as settings. When we got to the pandemic, so as local borough public health teams, which are often the ones that are promoting the programme, and we have the kind of advisory group that supports settings in places, a lot of the work turned to, I think as June's described, the early understanding of the pandemic, what it looked like for working with a range of settings. So, and what that meant for COVID, very much often through kind of local networks and support networks. And the role of councils, as you'll recall, evolved quite a lot during the pandemic. So really we had a kind of, year and a half kind of go at promoting it. There was very good uptake. I think the uptake exceeded maybe what colleagues were expecting in those early days. I have to say the last 2 years have been very preoccupied with support for a range of settings. So local public health teams, local children's services have been quite preoccupied with the issues we've been describing today around rollout of infection control guidance, making sure that we moved from a sense of shielding vulnerable children and adults to making sure that we were focused also on re-engaging children, families and settings that weren't required to shield, vaccination programmes, etc. So I think, COVID isn't over, we're not out of the woods yet. There are still pressures on services around absence, etc. But there's certainly a lot more bandwidth to kind of re-engage in that programme, and looking at the ways, in the context that we've been describing today, to re-engage with different settings in the programme.
How can we judge the success of the early years programme, as we don't seem to have any ways of measuring how successful it is?
So I guess so process impact outcome is the way we'd normally look. So processes around a new programme, engagement in that, and feedback. And I understand that's part of, you know, the kind of review of the programme now, kind of taking stock. If we're then starting to look at more impacts and outcomes, you know, over time we need to be developing that, don't we, with settings. When we look at a range of how you collect data across different services that are provided to children in early years settings, data is collected. If you're measuring outcomes for children, there are some harder measures that are collected quite holistically around things like, you know, obesity rates that are going into reception. You know, what's the impact been at the point children are leaving the school, immunisation rates, etc. But some of the ways in which services connect are not straightforward to have that kind of holistic overview. And you can't hold the early years programme to account for outcomes that are being delivered by a range of other services. So I think we need to be realistic about how we measure the impact of that programme, which is very much about supporting services, supporting settings in the outcomes that they feel meet the needs of their children, young people. So their areas of focus are going to be quite local and quite bespoke. And how that is contributing to some of the outcomes that we're seeing for children, young people through more independent measures.
That doesn't really, I mean, it says it's immeasurable, but it sounds like a nice thing to do. I mean,
process impact outcome, I suppose, is how for a lot of population health outcomes, where you're trying to look at, well, overall, what's the set of services, what difference are they making to children?
Yes.
Ready to learn at 2, yeah, ready to start school at 5, yeah, as the kind of key measures. We've also got the Healthy Start programme measures, so the review points, so the end of pregnancy at 2 weeks, the 6 to 8 week checks that GPs are doing, the 2.5-year check that children have, and then the kind of readiness for school. So I suppose it's trying, yeah, I understand the challenge. I suppose process impact outcome, and that's the framework we try to bring to kind of knit together the range of interventions by different services to the outcomes that we're actually seeing, the change in outcomes for children and young people.
With all those services, are we measuring the outcomes? Even if you're saying, well, you can't measure the contribution that one particular project has made to the overall objective, but are we measuring the overall objective? Are we measuring the healthy eating programme? And I know this is essentially a very local thing. The most effective healthy eating programmes work at a very, very local, a granular level, rather than big show-off things like junk food bans, which almost never work.
To Joanne. Public Health Outcomes Framework is the national framework to do that in terms of outcomes for population health. That goes down to various levels of granularity. A lot of it's just borough level rather than neighbourhood or local level, but some of that is available. And then, as I say, there's a number of service monitoring frameworks. The Healthy Child programme is the way you look at those milestones for children at those key points, end of pregnancy and all through the early years. I think to your point of who has that data, who collects it, who brings it back together, that is challenging. And if I, you know, in old roles, I wouldn't have that neatly sort of provided in a way that I could just look at that and interrogate it. So it's...
I mean, it's just a case of, you know, are we spending, how do we know that we're spending these resources in the right way? I'm not saying there's anything wrong with it. I'm just saying it's very, very difficult to make an assessment of whether or not that sum of money that we're, what was it? I can't remember what the figure was now. But that sum of money we're spending on the Healthy Early Years budget, is that the best way of doing it? I mean, I know we've got a number of awards to schools that have been given awards over healthy eating. Has that made a difference? So are we measuring, for example, the number of schools that weren't successful getting an award? That's the kind of stuff that we really need to see. And I understand that these are complex areas, but it's very difficult to get a handle on.
Yep, a couple of points on this, and then I've got some other things to say about some of the campaigns we're running. But can I just say, Andrew, at the moment we are reviewing the Healthy Early Years and the Healthy Schools. We're doing a quick review, and part of that will be looking at measurement tools. I think Vicky's right. It will vary between different settings, but can I just assure you that the 4 different levels of the Healthy Years Awards, the settings actually have to work to certain criteria, and they have to provide evidence that they have reached that particular standard. So I think around the quality assurance, I think we can be quite confident about it. But I will take your comments back into the review when we're looking at that. Can I say something about, I don't know whether we're nearly finishing, but we have been launching we have launched an early years campaign trying to encourage parents to take up the offer that started in December last year, and it's running to July, but we're thinking about possibly extending that. And that is linking parents on social media in particular to the DFE's website about childcare offers. We ran a similar one about 18 months ago, which was very successful. With regards to workforce, we do convene an early years stakeholder group in London, and we have put workforce issues on our next agenda, in part because June has lobbied us about it. And we will get the skills team there to see what more we can do on those issues. So I'm not promising a campaign as yet, but we're happy to talk about what we can do.
Thank you. We're going to move to Assemblymember Best. I think some of what Assemblymember Best is going to ask has been answered. So only feel free to add to the answer.
Thank you. I just want to quickly pick up, though, sorry, Chair, on this point, because I did ask last year, one of the first things I did once I was elected was ask about the healthy early years targets, and I was told by the Mayor these were being assessed. So today you're still saying it's being assessed. Last year it was being assessed. There's no targets. Now, I come from, you probably know from the early years background, so my understanding of the Healthy Early Years programme was that it duplicated a lot of things that were already in place, and it was a waste of money. And I can't see anything that tells me that that's different. And that's also someone that has a child that goes to nursery as well. So all I saw was duplication. It wasn't reaching targeted. It wasn't targeted to support to help those that needed it most. And I don't see any rebuttal to that because you don't have the evidence to prove me wrong. And it's been a year. It's been assessed. The question, Joe, you were about to answer, I think, there, but it's what further action has the Mayor taken to support early years services and the early years sectors since the start of the pandemic, and what has the impact of these actions been? And I think, you, as the Chair said, you were beginning to answer.
I think I've answered quite a bit of that throughout the meeting. So with our hubs work, we gave extra funding to the Wandle Early Years Hub, who developed some online teaching early years resources, digital resources for practitioners and for parents, which we have shared with other settings across the city. We have had our early years take-up campaign, and last week we, or I should say CPAG, because we commissioned CPAG to prepare a toolkit for employers to work with employees to encourage them to take up childcare offers as well. We have also, with the Strong Early Years programme, that's been a particular focus for early years throughout this. And we have also commissioned Pacey to actually deliver some work to Job Centre Plus, health visitors and social workers around skilling them up around childcare offers as well, so that they can be supporting parents, and they're going to be delivering that work over the next few months. So I think there's been a range, and we're still talking to the sector about what more we can do.
Thanks. And just looking at that, I asked earlier about the investment from the VRU and how that feeds into early years. Will you make that case that the Violence Reduction Unit must focus earlier and start with early years, and that could be done through family hubs. And I know Jane spoke about how we have these community centres both at nurseries or children's centres. There's a very easy way to tap into a resource that is already there. So will you make that case for the VRU to start earlier?
Yes, and I think many people around the VRU are taking that, and Lib is listening, which is why I know, that they are working on programmes for all ages. I think you raise an interesting point about the family hubs, because the government has obviously now allocated funding to certain local authorities. I think we've got 12 or 13 in London who have been given funding. So I think we need to see what we can do to support them, perhaps with best practice and some of the work we've been doing. But it'll be interesting to see how they develop. Yeah.
Thank you. And yeah, I think it's a shame actually we haven't talked more about family hubs, but obviously time's going on now. So to Jane and Joe and sorry, and we've still got Stella on the call, and Jonathan. Those you four, I would ask, what action would you like to see the Mayor taking to support early years services and the early years sector in London? And if you could make them very to the point, because I think the Chair will be wanting brevity.
Thank you. Shall we start online with Stella, perhaps?
Sorry, Jonathan's going to lead on this one, sorry.
Hi, I'm happy to pick it up, and I will be as brief as possible. There's a number of areas where we think there are opportunities. So we've talked about workforce. We feel that there's obviously the issues to address workforce challenges we've already talked about, but also maybe looking at early years qualified practitioners to be on the shortage occupation list, and whether there's representation the Mayor can make about the shortages in London, and how some work around that could be helpful. We also produced a report last year about earlier this year about £55 million worth of early years budgets remaining unspent in local authorities. Now, before today's session, we had a quick look at what that means in London. We think it's around about £15 million across London boroughs. Now, there are some London boroughs who've overspent, and there are some who've got underspends of more than £1 million. So there is work that can be done coordinating across London boroughs to look at those underspends, why they're happening, and maybe whether the rates that they pay to providers for the early years places could be reviewed in light of those underspends. And then there's another area around business rates. So this is twofold. In Scotland and Wales, the governments there recognise the contributions early years settings make and discount them 100% from business rates. In England, that's not the case, but local authorities do have the power to discount business rates by up to 50%. And one of the members earlier was talking about the costs to parents. Now, if we can reduce the costs of operating in London to nurseries and providers, then those costs can be passed on to parents, and those costs on average are over £12,500. But for some settings, certainly in central London, it can be a lot more than that. So those are areas that can be looked at on top of some of those workforce suggestions we've talked about with careers advisors, reaching colleges and children, younger pupils making those career choices.
Yeah, I think touching on family hubs there right at the end was interesting. So it's really interesting 12 or so of the 75 areas are in London. I think there's, at the moment, family hubs is a slightly sort of shell of a policy. So the funding's been delivered, and there's some things that family hubs will have to do. But we know that officials at the moment are considering a longer list of things. So I think there's something that London could do as a sort of a biggish group of family hubs to say, to push the direction of that policy, what should be going on in every family hub. And there's probably something London-wide on the point I made a few times around, could we build a clearer picture of those non-childcare early years services that children are accessing? So is there a job of sort of bringing together data that's held at a local authority level, so we can get a bit of a sense of what type of services are children accessing? Where's that fallen? Are there gaps? Are there disparities between boroughs in London?
So number one, I'd like to see some research on the implication of COVID on babies, especially babies starting in nurseries. Number two, I'd like to see that every London nursery has a trained chef in it in relation to our growing obesity crisis and in response to some of the work we've done on the task force. Number three, I'd like to see the mayors try and influence the shortage list and the essential worker list so that actually the amount is lowered so we can actually be considered in that. Number four, I'd like to see a career advice campaign, a large London campaign. Number five, I'd like to see the Mayor connect the green agenda and the sustainability issue, which is really interesting, and build a real strong early years narrative through it. He can work on the one that the DFE have already designed, but we could do something even more in London. And finally, I think we should celebrate some of the nice things we've done, like the research we did on bicycles with other social enterprises in London, a collaborative report which looked at green spaces, using green more, engaging families in going to parks and widening up the whole sense that parks become less scary places because families start to use them.
Thank you.
Sorry, Chair, I did have one more question. I'm trying to be very brief.
Very quickly.
I think today, obviously, we've only just skimmed the surface of the effect on early years and the COVID cohort of children. Putting together some of those ideas you've given at the end and throughout our session and our earlier session, I would like to ask the guests if you would advocate that we have some sort of early years action plan sitting under Joe's remit, and Joe, whether you would be willing to take up some sort of early years action plan, if that was something that would be, before the committee makes its report, obviously, it would be something that you would think would be a good idea to the guests, and whether you would be receptive to it.
Can I just say, firstly, the provision of early years settings is a duty of the local authority. So I think Joe's suggestion about data management stuff is very good, but we've had difficulties in the past with local authorities wanting to duplicate things, sending them to us, and we have an awful problem getting data out of government. So we're happy to look at it quite happily. But it is difficult, and often we don't have statutory duties. I think
not
with
asking you to
regards
wade in on statutory duties,
yeah.
but there's an action plan of things that we can do, and so it's not to wade in on statutory duty.
I think we sort of almost have that anyway, with the work we've been doing about the take-up and the whatever and workforce issues we're looking at. I think it had to be a sort of a developing issue that can respond to different issues, so it had to be quite flexible.
Or we could be entirely ambitious and take that and actually turn it on its head and start with the principle that you want London to be the best place for a child to grow up, and then you use that as your strategy, and then of course you then have the early years, you have families, you have family support, you have dad support, all of that built around it. But actually, instead of having all the divisions and projects and the kind of funding carry on that goes on that divides people, you actually put the child right at the heart of it, and then write your support and your policies around it, so we can advance what is possible within the mayor's remit, but also what's possible in terms of the collaboration across London, so we don't end up only seeing it as an early years issue when actually it's a child issue and it's a city issue, and there's some amazing stuff going on in other parts of the GLA that could be connected, like community cities and all that sort of stuff. So we could put it through that lens instead and think, how do we make our children citizens of London from the time they're born?
Thank you. I think we're going to have to leave it there in the interest of time. But thank you to all our guests for all your contributions today. To the committee members, can we note the report and today's discussion? Noted. Can we also delegate authority to me as chair in consultation with party group lead members to agree outputs from the discussion? Agreed. And can we note the work programme and our meeting dates as agreed by the Assembly at its annual meeting on 9th of May 2022?
Just on that, Chair, when will we next have a chance to have a look at that work programme?
So we usually time it in line with the meetings that we have, so it's taken offline with the group lead. So I think the last one we had was last week, was it? So please stay in touch with your group lead, but it will be in the diary.
Cheers.
Thank you. And the date of the next meeting of the committee scheduled for the 30th of June 2022 at 10 a.m. In this very chamber. I have no other urgent business. I therefore declare this meeting to be closed. Thank you to our guests and all our guests who joined online and for the first session as well.